all areas of England and Wales except the east of England. Let's talk a little bit more about that particular dispute with Sara Gorton. She's from UNISON, which represents the striking ambulance workers. Good morning, Sara. Thank you for joining us this morning. There are so many different disputes, as we were just outlining at the moment. Perhaps briefly you could outline for people what the issue that the ambulance staff have is.
So the dispute that's been on running for over 5 months now is about pay and staffing in the NHS. It's a failure on the government's part to put in the urgent set of measures that are needed in order to stop people leaving jobs in the health service, and that's contributed to an absolutely a situation where ambulance workers are no longer able to look after their they're not able to keep up with the cost of living, but most importantly they're not able to go to work confident that they can deliver the standards of care to their patients that they want to see. So this is an entirely avoidable dispute, and no ambulance worker wants to be taking action, but at the moment it looks inevitable that this is going to go ahead next week.
So just give us an idea of the kind of reduction you've seen in staffing numbers because of people leaving.
So there are 133,000 vacancies across the health service, and those come to a bottleneck when it comes to ambulance services, because there is a real difficulty in being able to hand over patients at the A&E departments because of low staffing. So we're struggling within the ambulance service because we don't have enough staff there, but also gaps across the rest of the system give a bottleneck, and it makes it absolutely difficult for ambulance workers to be able to answer all of the calls. So in the even a couple of years ago, most ambulance crew were able to go to 5 or 6 incidents in a 10 or 12-hour shift, and these days that's looking like 1 or 2. And not only does that mean that those ambulance workers are not able to see the full range of clinical incidents that they need to for their own development, but that most critically means that people are waiting in pain, both at home, waiting for an ambulance, but also waiting in the back of ambulances to be handed over for the urgent care they need.
One thing that has been said is you will continue to go to real emergencies, serious emergencies. This will affect only non-life-threatening calls. Can you give us an example of the kind of thing that maybe you won't go to now, something that is non-life-threatening where somebody won't get an ambulance on Wednesday?
So all of the arrangements for emergency cover are being worked out at local level. It's the employer's responsibility to set out what they need to provide, and as you've seen, that might have got much more complicated with the contingency plans that the government has intervened. So that the announcement last night of the military personnel might mean some of those need revisiting. I don't know, but those will be very carefully worked out, and there'll be systems put in place to try and ensure that any life-threatening call will be responded to.
We were speaking to someone from the NHS Confederation earlier who said that taking action during winter pressures takes risks. Sir Jim Mackey, who you'll be familiar with, is quoted as saying the action by the ambulance teams is a completely different order of magnitude of risk compared with the nurses' strikes. Of course, they're almost coming together on consecutive days. And he was urging the guy from the NHS Confederation for you and the government to be pragmatic to try and solve this. Are you willing to be pragmatic?
We would love to sit down and solve this. Health workers want to be part of the solution. Trade unions want to be part of the solution to the staffing crisis in the NHS. We started this year with a request to government to sit down and work with us to find ways to stop people leaving jobs in the NHS. They've been stubbornly ignoring us, and we've seen the number of those vacancies grow every single month. Every single month, more people are waiting for treatment. Every single month, more people leave jobs in the health service. We have to do something to turn this situation around.
But do you
And
accept
trade
that you're putting,
unions-
excuse me for interrupting, but do you accept that you're putting patients at great risk in taking this action?
So every single day, patients are being put at risk of harm because of the staffing crisis. Obviously, during a strike, there is, unfortunately, more risk on strike days. But the hope is that by withdrawing their labour for one day, paramedics, emergency care assistants can bring attention from the government, and that they will sit down and work pragmatically with us to sort this out and make patient care better for every day forward.
Sara Gorton, thank you very much for talking to us.